Chlorine is the most popular pool and spa disinfectant. Its purpose is to sanitize, disinfect, and oxidize. Chlorinated pool water may contain two forms of chlorine: free chlorine, which is still active and able to destroy bacteria and other harmful organic materials as they enter the water, and combined chlorine, which has already used up its ability to disinfect. There are several forms of chlorine available today, granular, tablets, and liquids, just to name a few. Each may have a distinct advantage or ease of application, but once they are in the pool, they all do the same thing: sanitize, disinfect, and oxidize your water. Organic material, bacteria, and algae are regularly introduced into the pool water, yet are not always visible by the naked eye. That is why it is so important to maintain a free chlorine residual of 1 to 3 parts per million to keep your water free of these microorganisms. It is an overabundance of combined chlorine and not enough free chlorine which causes the eye irritation and the strong, sometimes offensive odor often associated with chlorine. Many people incorrectly assume that this foul smell comes from having too much chlorine in the water, when actually increasing the free chlorine level by adding a large dose of chlorine or a non-chlorine shock will correct this condition. Depending on the type of chlorine you use, you will need to add it daily or weekly to maintain a free chlorine reading of 1 to 3 parts per million. Chlorine rapidly dissipates in sunlight. To help shield chlorine from the sun and slow this process, you will need to establish a level of cyanuric acid, also known as conditioner or stabilizer. A conditioner reading of 30 to 50 parts per million will greatly reduce your chlorine consumption. Keep in mind, slow-dissolving tablets, also known as trichlor or dichlor, are already stabilized. Stabilized chlorine in the form of slow-dissolving tablets are available in various sizes: 1-inch tablets, which should be added every 3 to 5 days, and 3-inch tablets, sticks, or rods added every 5 to 7 days. Automatic chlorinators and floating dispensers use stabilized chlorine tablets to deliver a steady and consistent level of chlorination. Check your chlorinator or floater weekly and refill as needed. The dial setting or openings can be adjusted up or down to maintain the desired free chlorine reading of 1 to 3 parts per million. Remember to only use trichlor-type chlorine to refill your feeder or dispenser. The free chlorine test measures the available level of sanitizer in your pool water. Test your water 2 to 3 times per week and maintain a free chlorine reading of 1 to 3 parts per million. AquaCheck Yellow Test Strips provide an easy and reliable method of testing. Simply dip a strip into the water for 1 second and remove immediately. Hold strip level for 15 seconds, then compare free chlorine, pH, and total alkalinity indicators to the color chart on the bottle label. You should shock or superchlorinate the water every 1 to 2 weeks to destroy organic contaminants and combine chlorine, ensuring clean, clear water. When superchlorinating with chlorine shocks, you should achieve a free chlorine reading of 10 parts per million. You will need to test the free chlorine and be certain that the level is below 3 parts per million before re-entering the pool. This can sometimes take up to 24 hours. Non-chlorine shock treatments, or monopersulfates, can also be used to oxidize and destroy organic contaminants. When using these shocks, you can re-enter the water within 15 minutes. Alternative sanitizers are an option that can be used to supplement your chlorine program. Mineral purifiers, ionizers, and ozonators all use minerals or ozone to destroy bacteria and algae, requiring less chemicals to keep your pool water treated. This allows you to maintain a much lower chlorine residual of 0.5 to 1 part per million, reducing your chlorine consumption by 50 to 80%. Let's review the basics. Routinely add a daily or weekly maintenance dose of chlorine to maintain a 1 to 3 part per million free chlorine level. Test the water 2 to 3 times per week for free chlorine, pH, and total alkalinity readings and make any necessary adjustments. Superchlorinate or shock the pool every 1 to 2 weeks with a chlorine or non-chlorine shock treatment.